mean, these last 10 years, there's yoga, breaths, and all sorts of belly breathing that we're learning, but you're really connecting it to the power of our own health. That if we understand this better, we could really be healthier, longer, even heal ourselves. You have some patients who come in very symptomatic with very difficult things, ailments that you have helped them recover from without surgery.
Absolutely.
That's amazing.
Absolutely. More people than I think I even understand. I have to tell you, breath work was not natural to me. It's really an internal biofeedback system that we have built in. Biofeedback, I always try to, for those people who don't know what biofeedback is, it's a way for you to deliver your own stimulus to yourself. So you are creating the stimulus and the response. Okay, so I think like if I'm tapping on my hand, I can feel my hand tapping, and I'm also having my hand tapped. So that's a feedback system that I'm creating. Okay, it's a sensory signal that I'm giving out, and I'm feeling it in my own body. So when it comes to the human body, we are not really connected to our inner body walls. Okay, this is what this is about. So we have these boundaries, our abdomen, our pelvic floor, our lower backs, and our brain does not really process those muscles very well. It doesn't see these muscles on our homunculus, on our brain maps. In order for our brain to navigate these parts of our body, it has to do it from the inside, because we don't see our pelvic floor and people don't talk about it. So we don't really know what it does. And because of that, we don't gain control of it in a purposeful way. So the way to do that is to put pressure on your pelvic floor with airflow. So what you're basically doing is you are pulling air into your body with your sniff. The sniff is a orofacial movement. It's how we smell. But when we can pull air into our bodies, not into our chest, but expanding our lower abdomens, which is really a diaphragmatic breath, but we're also incorporating our pelvic floor into that breath, which starts with the sniff. We suddenly get a feedback to our brains about where those muscles are in space. That's the easiest way I can describe it. So if I am pushing my belly out with my sniff, my brain gets an image that my belly's out. So for all of us that are sucking in our cores all day and we're doing it unconsciously and we're not aware of it, if you learn to push your belly out with that sniff pressure, you start to gain a somatosensory awareness of where your body is in space. And that's something we need to develop as children, because if we don't develop that, we're not peeing properly or pooping properly.